could you explain to us some of the difficulties you've had with your daughter and vision care pertaining to that in particular?
Yeah. So when she was 2 and 3 years old, her dad and I started to notice that she would run into things, and that she had trouble like even catching a ball. If you threw a ball to her, she couldn't see where it was coming to her, and that would be like suddenly, oh gosh, I didn't catch it. And so she had a regular vision exam, and they felt like her vision was fine, which we didn't think was true. So we took her to a clinic that had a specialty in pediatric vision, and they referred her to a specialist on eye coordination issues. And so she was able to get seen by that specialist and given some exercises. And we did the exercises every night. It was a lot of work, but it really paid off because after a year, her vision had improved so much she didn't even need to do the exercises. And now she's a super reader at 6 years old, and just doing really, really well. But it was a lot easier for me. I'm a clinician. I'm a physical therapist assistant. It was a lot easier for me to know that there was something wrong, and that she needed help, and to know where to find that help. And I think if I wasn't hooked into the healthcare system, I wouldn't have had any clue, and it probably would have been a lot more difficult to get her the help and even to do the exercises with her, because I was already familiar with them. I just didn't know what was wrong with her. And so it's made a huge difference in her life, a huge difference in her quality of life and in what she's able to achieve in school as well.
Excellent. At the beginning of the story, you were saying that you knew that something was wrong. What was it that the turning point that something wasn't quite right? And I'll explain a little bit for myself. For me, it was my son. He wasn't performing well in school. Were there anything similar to that?
Well, she wasn't in school yet, but I just noticed that when she was playing, especially with other kids, it was really markedly different. Her ability to tell, like, if they were throwing a ball at her, where the ball was at, or her ability to tell where an obstacle was on the ground and not trip and fall. And I could just tell that she wasn't as coordinated as the other kids were, but I knew it wasn't like fine motor. So, and she's strong. It wasn't gross motors. It just seemed like she couldn't see what was coming at her. So that was kind of the feeling that I got, that something was not quite right.
Cool. So you said that you found an organization that specialized, or a doctor that specialized in vision therapy. Is that what it was called? Did they give you an official terminology for the kind of condition that your daughter had?
They said that she had a dysfunction with her ocular muscles, and that they weren't allowing her eyes to focus properly. So that was kind of the diagnosis that we were given. And I didn't know, how to get in touch with a specialist. I just knew to find a vision clinic that had a pediatric specialty, as opposed to just like a general, vision clinic at the mall or something. I knew that if they had a pediatric specialty, at least they would take her a little more seriously. And thankfully, it turned out to be a good pathway to getting her in touch with a doctor that really was able to address her problem.
Oh, okay. You mentioned that. How old was she when you first started to notice these things?
2 and 3. 2
and 3. Did she have like an official exam of any kind around that age? Official visual exam?
When she was, I think she was a little between. I think she's between 3 and 4 when she just had a regular vision exam, and they didn't feel like anything was wrong with her vision. I just felt like that wasn't quite right. So that's why we pursued another exam with a clinic that specialized that at least had a pediatric specialty.
Cool. I want to concentrate on that just a little bit more because, as parents, I'm a parent, we go to the doctor and we do like the checkups, right? And they do a visual thing, and those things aren't obvious at that point, and then the doctor often sends us home, everything's fine.
Yeah. I mean, and she is a terrific doctor, but I think it was sort of outside his area of expertise. And like I said, I think her dad and I were really active in trying to advocate for her, and that really had to happen in order to get her that help for her vision.
So what I was really trying to concentrate on is that a lot of us as parents, this thing goes unnoticed simply for that one reason. We do our checkups and we think everything's okay. And then we go home and we feel like, oh, okay, everything's fine, but the problems persist. So that's the part of the story that I wanted to concentrate just a little bit more on.
Yeah. After she had that initial vision exam and they said that her vision was fine and it was age appropriate, we just continued kind of watching the way that she was doing. And my biggest concern was that she would run into like a doorknob or something, and I didn't want her to get really hurt. I felt like I was constantly like putting my hand in front of her when she was walking to keep her from running into the wall or whatever. And I was like, this just isn't normal. She has an older brother and he doesn't do that. He's never done that. And so that's why we just continued to try to advocate for her and ended up getting her in. And I think we paid cash for the second visit because it wasn't covered by her insurance because she'd already had an eye exam. And so I think that second eye exam that we had at the clinic that had the pediatric specialty, I think we paid cash for that, but it was worth it because then when she was referred to the specialist, that was covered like underneath a different benefit, like under a medical benefit or something, which was a little more generous for her vision. So yeah, so it was worth it.
Yeah, definitely. So if I understand it, you're in fall prevention. Is that what you're into? Could you describe a little bit about that?
Yeah. So I've been working for the last few years with older adults on fall prevention, and I'm a physical therapist assistant. So I've worked with people in their homes, and I've also worked kind of from a public health perspective on fall prevention as well. And a lot of times vision issues are a really serious problem that doesn't get addressed with older adults. And it can be anything from cataracts to degenerations in their vision as they get older. But when people don't get vision exams, which very frequently older adults do not get regular vision exams, now none of that can be detected. And certainly I have rarely seen them get treated for, vision coordination issues or binocular vision issues or even peripheral vision issues, which is really a frequent issue in older adults and can increase their risk of falling. So it would be wonderful if they could get that kind of help as well. But for them, it's even just getting an eye exam at all because it's often not covered by insurance. And oftentimes it's just one more appointment that they don't want to have to go to. But yeah, I think it contributes mightily to their disorientation and balance issues.
Excellent.
Especially the loss of peripheral vision.
Okay, two more items, and one of those two is: do you have any advice for parents or for older people preventing falls? What kind of advice do you have for them about their vision?
Yeah. So I'd say, if you're a parent or if you're a child of an adult parent, that you look at, if somebody's having difficulty getting around, if your child seems to be running into things, if they seem to not be able to catch a ball right, or they just seem like they're clumsy or discoordinated, then make sure that they get in to be seen by an eye doctor that has a specialty in pediatrics, and that you tell them what's going on and what you're concerned about, and not just have them just do a regular exam, but tell them, look, this is why I brought them in. I'm concerned that they might have some issues with the way that their eyes focus. And the same thing, for older adults, whether you're a caregiver or a family member, you'll see that they start to be losing their balance a lot more. They don't seem to be able to see you when you're standing over here, whereas they normally could. Make sure that you get them in to see their eye doctor and let them know what you're concerned about. Go to the visit with them and tell them what your concerns are so that they are really looking at those issues and not just checking to make sure they can see the letters on the board.
Excellent. Last piece, I asked some questions about vision. I asked some questions about falling. Is there something else that maybe we didn't cover at all yet that you wanted to bring? Is there any final thoughts that you'd like to share?
I guess I'd just say, you need to advocate for the people that you love and make sure that they get the care that they need. But there are specialists and there are people who can help with this issue. It's not hopeless, and with treatment it can get better, which is really, really important to know.